China grappling with a surge in respiratory illness presently. China's health ministry has urged local authorities to increase the number of fever clinics as it is grappling with a surge in respiratory issues in its first full winter since easing out the COVID-19 restrictions. Now, the spike has become a global concern. When the World Health Organization asked China for more information, citing a report on the clusters of undiagnosed pneumonia in children. It was by the Programme for Monitoring Emerging Diseases. National Health Commission spokesperson has said that the surge in acute respiratory illness was linked to the simultaneous circulation of several kinds of pathogens, mostly influenza. Cases among children are appearing especially high in northern areas. For example, in Beijing, hospitals are warning of long waiting queues. My colleague Sneha Mordani spoke to one of the Chinese human rights activists, Jennifer Zheng, and she'd spoken to her earlier as well during COVID-19. Here's what is being said about what's unfolding this time in China.
And joining me now is Jennifer Zheng, Chinese human rights activist and lawyer who's been putting out several videos of children at OPDs, hospitals are inundated and schools have been closed down in several districts. Jennifer, your videos, in fact, are bringing what many say is the truth really before the world. The WHO has taken note. Talk to us about how bad is the situation, which are the worst hit districts in China right now?
I think this wave of outbreak actually first broke out in Dalian City, Liaoning province, that is in the east north of China, and then it spread to Tianjin, Beijing, and then Shanghai. Right now, I think the northeast and the northern China could be hit very hard, but also we saw videos are now coming from Shanghai, that was in the east or southeast of China, like Shanghai, Nanjing, and even southwest provinces like Sichuan province are also hit very hard. So these are the situation we know, especially in Shanghai. I saw videos and social media posts saying that in a single day, 400,000 people could have already been infected, and in next week there could be 1 million people infected in one day. So overall, I think northern China, northern eastern China, and also eastern of China are also hit very hard at the moment.
Questions also are being raised about the authenticity of the videos you've put out. What's your take on that? Where are you getting these videos from? If you could please tell us who really is shooting them.
Well, I think people don't have to believe in me or the videos I have put out. The World Health Organization have already made formal inquiry, and I think the latest news is they already had a video conference or something with the CDC in Beijing, and the WHO also put out some or how the Chinese authorities are responding to this. They do admit that there's a huge outbreak, and they explain they gave out it. There is no new pathogens. It's all come from the already known pathogens. It's a mix of them, and it's just a sudden, you can say, hype of the cases. So there are also some official reports and also some kind of official explanation to tell people why there is a sudden outbreak. So you don't have to believe me or whatever, but I think the World Health Organization has already taken notice of what is happening in China. So you can refer to those. So where are you getting these videos from? Well, basically from all sorts of Chinese social media. As you know, the Chinese authorities or the Chinese Communist Party has a habit. I think it has already become instinct now. Whenever there is any negative news or bad things are happening in China, the first reaction or the instinct is try to cover it up or suppress down the true situation. So don't let the CCP look bad in the eyes of the world. So people have to, there's no official reports or videos you can say. So people have been passing around this kind of videos in social media. That's virtually the only platforms where you can get them. And who is shooting them? I think by ordinary citizens, like there could be a parent who sent their children to hospital, and then he was overwhelmed and shocked by the sight in front of him. At least I saw one video from Beijing Children's Hospital that was obviously uploaded by a parent who was still in the hospital. So while he uploading this video, he sent a text message as well saying that there are so many people here now. There are already 3,000, the number, everybody, when you arrive at the hospital, you were given a number, and then they will call your number when it's your turn. So when he came there, the number has already reached 3,000. So he advised other parents not to come to this hospital and go to some other places, because he said now we are only in some 2,000 range. So, but there are already over 3,000 people here, so don't come here. So I think basically they are just ordinary Chinese netizens or citizens are uploading this. So, and then they get passed around because everybody is very concerned about the situation, and every family may have a child or children. So, and there are a lot of parents already have encountered the same problem. So that's why these videos got passed around on social media.
Jennifer Zheng, I'm going to thank you for joining us, sharing with us those details that you've been, in fact, sharing on social media, keeping us posted about the current situation in China.
And while, of course, we wouldn't want to alarm the viewer, it is an update that India has also asked its states to prepare already. And here's hoping that we don't enter into 2024 with another disease coming in from China at hand. Preparations are underway already.
India's #1 political reporter
defines what seems to be happening, vendetta politics. कोई दूध के से धुला हुआ नहीं है.
Unmatched eye, unmatched experience.
The world has changed. My black hair has become grey as well.
And with unmatched passion for the story.
Do not monopolize the conversation.
When it's 100% news that matters. It's News Today with Rajdeep Sardesai. Monday to Friday, 9 p.m. Only on India Today TV.